Hello friends, welcome to Dentistry Update, Journal Discussions. Today we are going to discuss about the most important topic in implant dentistry. Higher implant torques are used to give adequate primary stability. Does this insertion torques affect the bone and osseointegration? This article gives us a clear update about this. Dental implants have been used for many years because of their high success rate. The main factor that may contribute to the success of dental implants is their primary stability. Primary stability is required to avoid micromotion at the implant-to-bone interface. A threshold of micromovement between 50 and 150 mm because excess micromovement could affect the process of bone repair and consequently compromise osseointegration. The primary stability of dental implants may depend on clinical factors including bone quantity and quality, the macrogeometry of the implant, and the surgical technique used for implant placement. A correlation between primary stability and insertion torque of the dental implant has been reported with the suggestion that to achieve adequate primary stability, dental implants should be placed with high torque values. In an animal study, dental implants placed with a high torque showed higher bone-implant contact during the first weeks than did those placed with low torque, but these results were not maintained after the implant healing period. Authors concluded that there was no negative impact on the biological process of osseointegration with the use of high torque during the placement of dental implants. Inserting the implant to 70 Nm in bicortical bone and 50 Nm in monocortical bone has been reported to lead to microfractures of the bone threads around the implant. Excessive compression of the bone may affect microcirculation, which may lead to osteocyte necrosis 12 and increase the risk for implant loss. Various clinical studies had verified that low torque, less than 30 Nm, is sufficient for optimal osseointegration regardless of the treatment protocol. Another study reported that an intermediate torque, greater than 32 Nm, but less than 50 Nm, is required to ensure restoration survival. In contrast, a high torque, equal to or greater than 50 Nm, did not affect the osseointegration process and may be associated with an increase in survival rate. This systematic review and meta-analysis were to evaluate the influence of different insertion torques during implant placement, low or regular torque versus high torque, in terms of marginal bone loss and implant survival rate. This study was conducted and structured according to the preferred reporting items for systematic reviews and meta-analyses in accordance with previously published systematic reviews. This study included randomized controlled trials and prospective studies that evaluated high torque compared with low or regular torque implant placement in the same study. They had excluded animal studies, in vitro studies, case reports, studies with follow-up duration less than 6-month studies that evaluated only high, low, and regular torque without comparison, and reviews. Two independent reviewers conduct an electronic search of the PubMed/Medline, Scopus, and the Cochrane Library databases for articles published until April 2019. The keywords used in this search were insertion torque or high torque or low torque or regular torque and dental implant. Articles were classified and the difference was resolved by a third author. A total of 6 studies was selected. All included studies reported data regarding implant survival rates. 2 studies reported 100% survival rates. 4 studies reported marginal bone loss. All included studies reported high survival rates irrespective of the insertion torque evaluated. 2 studies reported 100% survival rates, but these studies performed an evaluation for a maximum period of 1 year. The authors reported failure rates of 14% for regular or low insertion torque as compared with 0% for high insertion torque. Thus, these authors recommend high insertion torque for single implants. It was found that low insertion torque with 20 Nm is associated with a high risk of failure. 9 of 10 implants failed, in implant-supported single crowns. High insertion torque can promote excessive bone compression, generating dangerous micro-cracks, or pressure necrosis, which disturb microcirculation and lead to bone resorption was not confirmed. The manufacturer guidelines advise that the use of high insertion torque may be contraindicated because it may increase the complications rates in the implant 1 abutment connections. High insertion of torque during implant placement has no significant effect on marginal bone loss.